What's up, guys? Welcome back to my channel. It's Roslyn. Thank you so much for tuning in. If you have not subscribed to my channel yet, please just go ahead and hit that subscribe button, press the like button, leave a comment for me if you have any. Let's chat. Come on, just tell me what you feel like. Today's video was suggested by one of my followers, and she is called Hadia Sabor. And Hadia, you requested me to share tips or advice for nursing students who are on clinical placements on how to manage and reduce anxiety levels. And the other thing that you also asked for was some advice for new nurses who have just finished their studies and are just joining the field. So this video is going to be like in two two phases. So I'm going to record the first one for the nursing students on clinical placements, and then next time I'll post a video for new nurses who are just joining the field. So welcome, and thank you so much, Hadia, for your suggestion. I really appreciate your time and watching my videos, and then also giving me a video suggestion. So thank you. So for nursing students, I am just going to talk to you in relation to my own experience when I was a nursing student, and also right now as a practicing nurse. So I was a nursing student a few years ago. I am now practicing. I have worked in the community, I have worked in the nursing home, and I am in the hospital at the moment. So don't know where life will take me next. So yeah, so I'm just going to share with you 7 tips on how to manage your clinical placements and also reduce on your anxiety levels. Tip number 1, if you're a nursing student and you have already been told where your clinical placement is going to be or your clinical area, one thing that I would do is to visit my clinical area, talk to people, talk to the CDN, talk to some nurses, just go around and familiarize yourself with the place, know where the staff room is, know where the handover room is. Just talk to people so that next time when you come, at least you're familiar with the place. I would do that if I were a nursing student who is about to start clinical placements. If you cannot visit your clinical area prior, you can also make a phone call and talk to the CDN. And usually it's the CDNs who orientate the students around the ward. They do the allocation for them, you know, whether to give you, I think, a morning or evening shift. So you need to talk to the CDN. As the CDN is a clinical development nurse in the ward or in your clinical placement area. So talk to your CDN or visit the place. That is going to be my tip number 1. That will help you reduce the anxiety levels completely. Tip number 2, familiarize yourself with your clinical specialty area. Like if I've been told I am going to, maybe let's say in a ward, find out what's the specialty in that area. What kind of patients do they admit to that ward? So that will help you like do a bit of research, you know, look it up, ask other people who are familiar, or just search up so that you, when you get into the ward, you know exactly the kind of patients that you are going to be looking after. Tip number 3 is please be organized and be prepared. Once you've known you're going for clinical placements, just know all your nursing essentials that you need. Go purchase them. It's even cheaper these days online, or just make sure you have all your nursing essentials with you. Don't go to your clinical area and start looking for, you know, a notebook, or I don't have a pen, I don't have, you know, I forgot my name badge, or, you know, all those nursing essentials that you require. Please have them in one place, put them in your bag. I usually have a pencil case, something looking like a pencil case, where I put everything of mine. Like I put my pens, I put my eraser, I put, you know, everything that I need as a nurse. So you know all your nursing essentials. Please be prepared and have everything in one place. So that's my other tip. The other tip is keep time. I cannot emphasize enough, please keep time. I have seen some students really like coming into the ward during handover, and they're like 5 minutes late, and they've walked in and they don't even like, really, I'm not bothered as long as I'm here. No, that is not the attitude a nurse should have. You need to keep time, please. Make sure you arrive like 10 or 5 minutes early and have a cup of tea, have a drink of water, move around and talk to people. That will help you reduce on your anxiety levels. All the little things that your clinical facilitators ask. Time management. Please, nursing students, make sure you keep time. Make sure you arrive to your clinical area on time, because if you miss handover is the main thing in nursing, because remember that you are transferring care from the previous nurse to you. So if you miss anything, your patient's care is going to be compromised. I tell you the truth, because that's why we have even the bedside handover, just to ensure that everything is handed over to you for proper continuity of your patient care. So please, my fellow friends, as nursing students, ensure you keep time. Time management is one priority that you really have to keep up. Another thing is, please have an initiative like to do things like to provide basic nursing care. Like, don't wait for your nurse to tell you, oh, can we please go check blood pressure? Can we please do this? You've gotten the handover, you got the handover sheet, you know your patients you're looking after. Please push your nurse, tell your nurse, can we please do this? So it's time for us to do blood pressure. Can I please go do OBS? Can I please do blood sugar levels for my patient? Or can we please, if that patient requires insulin, can we please do this? So that alone will show anybody you're working with, your nurse preceptor or your clinical facilitator, that you're really interested in learning, you're really interested in becoming a nurse, and you'll be a good nurse who will be providing good quality nursing care to your patients. So please initiate like providing care to your patients. Really, if you are not interested in learning right now, in doing things while you are learning, how are you going to provide full nursing care when you're all by yourself as a fully qualified nurse working and looking after patients? Everybody would like a good nurse to provide good quality care to them. So please initiate nursing care. Inform your nurse, this is what I'm going to do. Obviously, practice within your scope. So taking an initiative into doing things is one thing that nursing students have to learn. Don't wait to be told. Your clinical facilitators come and talk to us, the nurses who are working with you. Those are the small things that they ask. Does she initiate anything? Does she, do you have to prompt her? Do you have to push her into doing things? Do you have to remind her? So please don't wait to be prompted to do something, to provide care to your patients. Remember, you are in the hospital to learn. You are in the hospital to learn and look after real people. Initiate something and just tell your nurse, look, I'm gonna do this, or can we please do this? So, and you'll all be fine, really. The other thing is also ask questions. Please ask a lot of questions when you're buddied with a nurse. Make sure you ask whatever you're not sure of. Just ask. Don't leave the clinical area with unanswered questions. Again, I will say you are there to learn. So asking questions is part of learning. You cannot know if you don't ask questions, and if you don't know anything and you keep quiet, you're never going to learn anything. So please ask questions. I know for sure that even us as qualified nurses with experience, there's certain things that we don't know. It's not just that like we're stupid or what, but we all learn every single day. But let me assure you that even if you came to me and said, look, Rosalind, what is this medication for? Even if I don't know it, we'll always find out, from somebody who might know it, or we go look it up in the book or in the memes or anything. There's a place, you always find an answer to your question. Even if I don't know it, I'll go and ask my fellow nurses, or go and ask my CNC, or go ask my CDN. Ask anyone. Please, students, ask questions. Don't be shy. You are there to learn. And remember, communication is one key thing in nursing. So you got to learn how to talk to people, communicate, ask questions, and that's the only way you are going to learn. Please, and maybe that's the final thing that I'm going to talk about today, is make sure you keep a record of your attendance. Like every day you attend. I know our university used to give us attendance sheets. At the end of your shift, your nurse who has been working with you has to sign you off. I remember personally I had a problem with that when I was at uni. I did not get one day signed. So what happened to me is at the end of the shift, I was excited to go home, and I thought, okay, I was looking for the nurse. I couldn't find her. A shift had ended. I don't know whether she had gone home or not. I thought, okay, I'll get her to sign tomorrow. Little did I know that that day was her last day because she had days off and then off to maternity leave. So I came back a few days later, and then I did ask someone to sign, and they're like, no, I didn't see you around. So why did you get the nurse to who you worked with to sign? I went, everybody, I tell you the truth, nobody signed that form for me, which I did understand. I had to do an extra day to catch up with my hours. So please, nursing students, make sure you get signed off every day, you keep up with your nursing hours, and also the university will look at all that, your attendance sheet, and make sure at the end of, I think at the end of your studies, they look at all those hours. So you have to keep up and make sure that you've done the correct number of your clinical placement hours. So guys, thank you so much. That's where I'm going to end. I have given you my 7 tips that can help you as nursing students manage your clinical placements and reduce on your anxiety levels. If you have any questions or any comment, or anybody has something that you want me to talk about, please leave it for me in the comment section. Otherwise, please don't forget to subscribe, leave a comment, press the thumbs up and the notification bell. Again, I'm sorry I have been a little bit quiet. It's been so busy. A lot has been going on, and then there's a video my son captured, my 7-year-old, and he's still editing it, so I'm going to give him his time to finish because he also has to go to school. So I'll give him his time to finish it, and he'll post it whenever he is ready. So thank you guys, love you always, bye.